Okay, hey guys, this is Dr. Colin D with North Texas Facial Plastic Surgery, and these are my general post-op rhinoplasty instructions, and really apply to any nasal surgery, nasal septal reconstruction, nasal valve, stenosis repair, anything where we've had to make incisions in or around the nostrils, and you are trying to prevent the crusting around the nostrils, trying to prevent from your blockage from dry blood, red mucus, etc. So, beginning on day one, you're going to go home after surgery and have some sort of gauze taped underneath your nose. Change that out as needed. I hope that that's more like every hour or two, but if it's getting soaked, bright red blood, fresh blood, then you need to call us if that's happening about every 10 or 15 minutes or sooner. If that happens at first, that's not uncommon. You can try to do some sniffing, try not to blow because that makes things swell or bleed. Some sniffing and some saline rinses to try to get any clots out of there, and then use Afrin nasal spray. It's a decongestant. You can try that a couple of times. If that's still not working after 2 to 3 times, then give us a call. Pretty uncommon, but that's certainly possible. The mustache dressing, we call that, you probably will need to change out for that first day or so, first 24 hours, and then you shouldn't need it much after that, but it just prevents you from having to rub a lot because it's going to be sore underneath your nostrils. The first day, play it by ear. If you're having a lot of oozing, you probably don't want to go messing with it a lot, but if it's not much oozing and it's starting to get dried out, then you've got a handy dandy bottle of some hydrogen peroxide here and a Q-tip that's been soaked in it. You're going to clean around your nostrils on both sides, get any crusty stuff out. The top of the nostril is always the problematic part that people have a tough time getting all the crusty, scabby stuff out of there. Get all that out of there. If you have stitches from a rhinoplasty, it's going to make getting those stitches out a week later much easier. If it has a scab on there, it just hurts to get them out. So do your best. You don't have to be aggressive, but you can just sit there and let it bubble up, and you could go through Q-tip after Q-tip after Q-tip of the peroxide until you get it all out of there. Then just take a dry one, clean all that out of there. Take some of your antibiotic ointment. Most likely we've sent in a prescription for some mupirocin ointment. Put a thin layer on the Q-tip itself after you've cleaned and dried it with the other Q-tips. And then you can just take 2 of these and just run a thin layer around one of them and just run it around your nostrils, run it on any incisions. If you have incisions between your nostrils, sometimes we do incisions on the outer parts, just anywhere you have those incisions, because the moisture will actually help it prevent it from getting crusty again. Starting on the first day after surgery, which I'll call post-op day 1, you're going to want to do that twice a day with the cleaning and the ointment. In addition, you're going to do saline rinses. Some sort of salt water rinse up your nose. Saline just means salt water, so this gets confusing to people. This is the sinus rinse we refer to, made by NeilMed. I think that's the most effective, but it's also the messiest and the most involved. And so at least 3 or 4 times a day, I want you to use the NeilMed rinse starting on post-op day 1. The day of surgery, play it by ear again, just like with the cleaning. You don't necessarily want to do it every 2 hours the first day, especially if you're having a lot more oozing that first day. Once that settles down, you're starting to get clogged up. Some sort of salt water up your nose every 2 hours while you're awake. You can wake up to do it, but I'm not going to tell you that you have to. This is a squeeze bottle, so at first you can control with a little bit of pressure, and by the time you get really used to that, probably halfway through the first day, you're going to want to use a lot more power to help rinse and sniff that stuff out, back, hawk it up, spit it out, whatever you got to do. Sometimes it'll go in one nostril, out the other side, and vice versa. Sometimes it'll go straight up, straight back, goes in your throat, spit it out, swallow it, whatever you got to do. Just keep things moving. None of that stuff is required, just as long as you're keeping stuff moving. And that's pretty much it for the most part. Want to keep yourself elevated, not straight up, but just get your nose higher than your heart to make sure, maybe 30 degrees or so, to make sure that the swelling is at a minimum. And watch your salt intake, because if you stay beneath about 1,800 milligrams a day of sodium, that will really make a big difference as far as your postoperative swelling goes. That's the majority of the postoperative care. And if you do have a cast on the outside, keep in mind that has to stay dry. So having somebody help you wash your hair in the sink or get an appointment at a salon, dry shampoo, etc., is sometimes a good option as well. Otherwise, on day 6, when your appointment to follow up with me usually is scheduled for, you can take a regular shower. And if that gets wet and falls off, great, you just saved us some time. And so I'll see you in a couple hours after that. So if you guys have any questions, always feel free to reach out to us, but that's kind of it in a nutshell. So hopefully it's helpful to hear what to expect and how to perform that after surgery.